watch that later on that same page. For any interpretation, I'm going to give the instructions in Spanish. Buenas tardes. Para escoger la interpretación en español durante este informe comunitario, pueden pulsar el icono del globo que aparecerá en un momento abajo en su pantalla. Cuando pulsen, pueden escoger el idioma, que es español o Spanish. Si nos acompañan desde un teléfono celular, pulsen los 3 puntitos, escojan la interpretación y el idioma y luego escojan salir. Así podrán escuchar esta llamada totalmente en español. Muchas gracias. Welcome again, and thank you so much for joining us today. My name is Angela Cimental. I am the spokesperson for Boulder County Public Health, and we are glad that you are here today. Today, we have a very special town hall for parents and caregivers to talk and answer questions about the COVID-19 vaccine for children and teens. You will be hearing today from a great panel of experts. We have Dr. Lisbeth Mendoza, Boulder County Public Health Health Equity Coordinator, Dr. Chris Urbina, Boulder County Public Health Medical Officer, and Dr. Megan Adamson from Clinica Medical Provider. Before we start this, I just want to go over some housekeeping items. We will be taking questions at the end of the update. You can use the Q&A feature at the bottom of your Zoom screens. Please type your questions there during the Q&A section. For those on the phone, you can dial *9 to raise your hand and we will call on you to ask your question. To unmute, use *6. Please keep your questions short so that we can get to as many as possible. Now I'm going to turn it over to Lisbeth Mendoza.
Hello, everybody. Welcome, and thank you for joining us today. So we want to start with a presentation that I'm about to share with you. And we have Dr. Urbina today to help us with the data, navigate a little bit of the data on cases and testing and so on. Dr. Urbina, can you help us with this?
Yes, and thank you, Elizabeth, for inviting me. I really appreciate the opportunity to speak to our community. You know, you and I have done lots of these town halls, and we are excited about the opportunity to spread information, correct information, and not the infection. So I'm just going to walk through a few slides here that talk about the data. Not everyone from our community has seen slides like this. But if you look at the bottom, these are the dates over a period of time. And on the upward axis, the y-axis, are the number of cases. And you can see back in October and November on this slide, that was our huge peak of cases. And then over the summer and May, June, and early July, we had a significant drop in cases. But now look at that big number, 39.3 number of cases over the 7-day average. So you can see we're starting to see an upward trend in number of cases in Boulder County. Next slide, Elizabeth. So this is a different way of looking at it, and this is specifically age groups. At the top, we tried to give you a picture of ages 0 to 5, ages 6 through 11, and ages 12 through 17. And those are the orange, green, and blue slides. And if you look at the July, you're starting again to see an uptick in number of cases. Very important slide to notice because this is a time where kids are just beginning to go back to school. Next slide, Elizabeth. I know this is a very busy slide, but I think it's very colorful in the sense that we look at it in a different way. If you look at the 0 to 9 group, that's at the bottom, that's the blue dotted line. And the other groups that I want you to pay attention to are the dark blue and the dark green. Those are the highest rates of increases in cases among age groups. It's very worrisome. Again, those are college-age students, as well as young people going back to daycare and schools. Very important data. I just wanted to give you a reminder that we're not out of the woods yet. We're seeing a significant rise in cases, and we really haven't hit the fall yet. It's still lots of people in outdoors still. Next slide. This is a very important slide, and I want to highlight a couple things on this. This is the number of new cases, 7-day average, looking in it a different way. If you look at the black line, or blue, looks blue in my slide, that's 2020 at this time. Look with the orange line, that's the 2021 slide. So we're seeing a significant difference this night now versus last year. And we'll talk about why we think that is. And I think you know where I'm going with this. Next slide. So another way of looking at this, and remember the dial, and we're not going to talk about the dial, but this is what CDC transmission tracker is talking about. Low transmission is blue, moderate transmission is yellow, substantial transmission is orange. And if you look at the cases in Boulder County per 100,000 in the last 7 days, we are already in high transmission phase. So again, very worrisome. Next slide. I also wanted to point out that if all our surrounding counties are in that high phase, all the red slotted counties in the Denver metro area, Boulder is kind of right in the middle, Weld County is significantly higher. All of these counties are starting to talk about high transmission, and Boulder County is right among them, because we all know people live in Broomfield and they work in Boulder or vice versa. So we're all a mixture of folks that are unfortunately spreading this infection. Next slide. I think people also want to know, are hospitalizations increasing? So if you look at Boulder County, and that's the, Colorado, you can see an uptick again, starting again in August. You're seeing an uptick, not as high as we had in last November and December, but significantly uptick. This is what we would consider a fourth wave of the infection. Next slide. So, and I also wanted to talk about hospitalizations in general, just the hard numbers. We're still seeing an increase. Now we have 41 people in the hospital, in our hospitals now. And compared to last week, we have 566 cases in Colorado. So it's not only happening in Boulder County, but it's happening everywhere. We have pediatric cases starting to rise. And unfortunately, we've had 7 deaths in Boulder County since May 1st, for a total of 263 deaths since the start of the pandemic. This is another way of looking at it. For those folks that have participated in community forums before, we have talked about the positivity rate, or the number of people that are positive. And we can see over the summer months, that was early in May through June, we had a very low positivity rate. Well, again, the positivity rate, number of people that are positives, are starting to increase rapidly. And this is all due to the Delta variant. We don't have a slide specifically about that, but Dr. Adamson and Dr. Mendoza will go into the details around the Delta variant. But I just wanted to share the numbers with all of you so that you understand that it's not business as usual, as we saw in the outdoor months of June, July, and early August. We're starting to see a significant number of positive cases in all age groups, hospitalizations, and deaths. This is very concerning. So I'm going to turn over the slides now to Dr. Elizabeth Mendoza, who's going to talk a little bit about vaccination rates in Boulder County. Go ahead, Elizabeth.
Yes, thank you. So I don't want to, take up much of your time with numbers, but just in general, I want to call your attention that when we hear numbers in the news and we talk about it, we have to make a distinction between the population that is eligible to get the vaccine and the population that is not eligible. So sometimes you hear the data like this one, that we have 80.7% of the people here vaccinated. But this is the eligible population, and we can't forget that we have kids under 12 who are not eligible, and other people who cannot take the vaccine for different reasons. So when we factor that into these numbers, then we see that our vaccination rate really in the community can drop up to almost 75% of the eligible population that has had, from 80 to the 71. So then, so there's a big difference. It's like almost like a 10% in a difference. But and this is important because we need to think about the kids who cannot get vaccinated. And that's why we are here. Some of our kids can get vaccinated. Some of our kids can't. Maybe in the future they will. We don't know when, but it will. And for them, we need to protect them. When we hear somebody's not vaccinated, that person is unprotected. That's how we want to see it. So we don't want to just, be super happy. Oh, 80%, that's it. Well, not really. Not everybody is vaccinated, and we have to think of it this way. It's a collective situation, not just an individual situation. Really, at this point, We have about 113,000 people in Boulder who have not received a vaccination for whatever reason. And that's a big number. The number of doses are dropping and given daily, we're dropping, and they are starting to increase, of course, because now people are realizing when we're going to school, but also I think people are realizing that the Delta variant is no joke. It's really a big deal. This variant is more transmissible than the others that we had before, than the one that we had in the summer. And we can see how the numbers are increasing so much from the last summer to this summer. And we believe this can be something to explain, because this variant is so transmissible. I like to use this an analogy of like vaccination in the community is having like a wall to stop the transmission or to stop the pandemic mostly. And each person vaccinated is a brick. Each person that does not get vaccinated is a hole in that wall. So we can't really finish to stop the pandemic. We can't really limit it until everybody gets vaccinated and put a real stop. So that's why we want to get as many people vaccinated. When we look at the kids, see, this is a big number. It's approximately, I'm like near to 40,000 of school-age kids are not eligible or are not vaccinated. And that's a lot of people as well. So then, again, we just have to think about the kids and where are these kids mostly, or the most of these kids is in the city of Boulder, Lafayette, Longmont, and Jamestown, just to be aware. And here are the numbers. Again, I don't want to make you all dizzy with numbers. We can move on. This one I did want to show you because this table, what it shows is the vaccination by age, either having a full course or a partial course of the vaccination. And when you look at the percentages that are the lowest are in the groups from 0 to 29. That's the lowest uptake. And well, the 0 to 11, obviously, because they're ineligible, but the others are, they're eligible. So we want really to raise those numbers. This is an interesting chart that shows according to age, and these are like, it's like a pie. If we were to give a piece of a pie to a population by ages, depending on the not uptake of the vaccine, we can see that the biggest pie will be taken by the people 20 to 29. That's something that we observed in the other data before. And then we'll have the kids between 12 and 19, and then finally the people between 30 and 39. So among the people eligible, these are the people who are not getting vaccinated as much as the others. So we really want to work with you guys, or for you as parents, or you have students, kids that are students, to kind of like diminish the amount of the pie that we want to give them. And then again, this is a very busy one. It shows a lot of numbers and a lot of data. Just as average, you can see in the columns ages, and then this is divided by ethnic groups. But anyways, if we look at the ages, the most kind of like despair, or the most different numbers or lowest numbers you can find in people between 12 and 29. And yes, in our populations that are minorities, that are from other ethnic groups or races. So we're working really hard with them. And still we're seeing an improvement in the vaccination rate in them. This is going well, but we need to help them to get access to the vaccine. And well, in general, all over in the whole metro area, we have that about 75% of the people that are eligible, they have at least a partial course of it. And this about it, also another thing to note is partial is not enough. We want to have complete doses. So if you haven't gotten your second vaccine, you forgot whatever, go get it, because we want to count completely vaccinated people to get the full coverage. Who are the areas that are leading this vaccination is Broomfield, Boulder, and Denver, with different numbers. And you can see them in this graph. Boulder, Broomfield, and Denver are showing the highest rates of vaccination. And where can you find more information? In our website, there's like so many pages for it, but there's one that is particularly for where can I get the vaccines? And if you go there, you can find the list of all the providers. And you can also find, if you navigate that webpage or the website, You can find more information about the COVID and about the vaccines and so on. One thing I just want to say is, because this is something I get asked about a lot among families, is where can I get my kid vaccinated? And really, nowadays, there are so many places where you can do it, not only hospitals or clinics. If you don't have a hospital or clinic that you belong to or that you trust, well, you can go to the supermarket, you can go to a pharmacy. If you still are not sure to get that, well, you can go to a community clinic. There are a lot of community clinics happening nowadays, sometimes near your neighborhood, because there are so many. You might be able to find some clinic that is convenient for you. What you need to look for is anybody who's giving Pfizer vaccine. Is where you can get your kid and your family, your entire family vaccinated. Pfizer is a vaccine that is for the kids 12 and up. So that's what you want to look for, besides the location and everything. Just make sure that that's what they give. And I think we're gonna leave it there, and we can move on finally with our guest, Dr. Megan Adamson, because we are very eager to hear what you have to say. So, Dr. Megan, welcome to being with us. And please, can you tell us a little bit about yourself? And I have a couple questions for you.
Yeah, absolutely. Thank you so much for having me this evening. I'm really glad to be able to speak with everyone who's on. So I'm Megan Adamson. I'm a family physician at Clinica Family Health here in Lafayette. So I take care of people of all ages, newborns to the elderly, in our outpatient clinic.
Thank you. Thank you for taking this time, Dr. Megan. Well, I have a question. Well, I have two questions to begin with for you, and then we'll open it to the public, of course. But one thing. So you, as a medical professional and a healthcare provider, and that you have been in the front lines of the vaccination efforts at Clinica, very important institution that helps us with all these communities and that helps everybody in the community, basically. What is your opinion about why is it so important to get the teens vaccinated against COVID-19?
Yeah. First and foremost, I think it's really important that we get our kids vaccinated to keep them from getting sick. So while children haven't typically had as severe symptoms from COVID, there definitely are some that have very severe infections as well. About 2% of kids who get COVID do end up in the hospital, and some of those need to be in intensive care. And so we want to prevent especially those very severe infections, but even just the inconvenience of getting a viral illness is helpful to prevent. There are also some kids that have some complications, whether they have a mild infection or a more serious infection. Although it's rare, there's a condition that is called multi-system inflammatory syndrome, where kids can get inflammation of various organ systems, whether that's the heart or kidneys or skin. And those sometimes can be very severe and serious. And so we want to prevent that. And also can cause some complications for kids. So including, I had a patient here in clinic who had COVID and ended up with this multi-system inflammatory syndrome, and so had inflammation of their heart that was keeping them from doing the just usual activities like going to PE or participating in sports. So we really want to keep kids healthy. I think
Can I ask a follow-up question, Dr. Adamson?
Yeah, absolutely.
Can kids spread the infection to other kids, particularly in daycare and in schools? And if they get infected, could they spread it to their unvaccinated family members, siblings, etc.?
Very much so. So that's absolutely the second main reason for kids to be vaccinated, is that even if they don't have a serious infection, they can pass it on to others. So especially other household members, and they can pass it between each other. So there was a study, this was done in Canada, of kids, and it was found that for many households, that initial infection did come from kids who were either in school or in daycare. And on average, when a kid was that initial infection case in that household, they did pass it on average, 2 other people in that household. So whether that be their sibling or a parent or a grandparent. So it is very important to help prevent the spread of COVID to get kids vaccinated so that they're not sharing it with folks who are more vulnerable. And then obviously all of us would like to get back to life as normal. And so having more people, including our children, vaccinated will help us get back to being able to have bigger family gatherings and celebrate holidays. Obviously, this past year has been very challenging for kids and families, not being able to attend school like usual and having a lot of social isolation for our kids. So we'd really like for them to be able to have a more normal school year and be together with their peers and their friends in a way that is safe.
Thank you very much. Well, and the second question for you, Dr. Megan. So as a member of the community, can you share, if you want to, your personal story about how you decided to get, for one thing, your COVID vaccination, and if you have kids that are in that age of eligibility who got vaccinated, why did you decide, why your family decided to vaccinate the kids?
Yeah. Thank you for that question. So I have had my COVID vaccine and I got it early on as a healthcare provider. And in large part, that was because I work in a setting where I have contact with people every day and I didn't want to risk bringing an illness to my family. I do live in a multi-generational household. So I have 3 boys with my husband and my father as well, who's elderly. And so I didn't want to risk sharing an infection with them. And subsequently, as more and more people were eligible, my parents got vaccinated, my in-laws got vaccinated, and we all received the Moderna vaccine. My husband ultimately ended up vaccinated and got the Johnson & Johnson vaccine. I have 2 of my 3 boys are in the age range where they're eligible to get the vaccine. So my 13-year-old and 15-year-old have gotten the Pfizer vaccine. And then I have a 9-year-old who's not yet eligible to get a vaccine, but I am very hopeful that that will be coming about soon. And I definitely do plan on getting him vaccinated as soon as he is eligible. And really the biggest thing, again, is just to be able to get together as a family. I want my kids to be able to get back to their usual activities of being able to play sports and hang out at their friends' houses and, just be able to get out in the world and enjoy the stuff we like doing.
Thank you for sharing that. Thank you very much. Well, we are thinking if there is anybody who has any questions at this point, and if not, we can continue with asking some questions.
I have a question that I commonly hear from the community a lot, and I'd like to ask both of you this question. What I hear a lot is this vaccine has been short time. It's only been in a little bit over a year. It's not really safe. Could you talk about the safety in everyone, but also particularly women who are of childbearing age who might be considering being pregnant or are pregnant, and the safety of the vaccine for elderly, people with chronic medical conditions, and particularly pregnant women? Could you both comment on that, please?
Sure. So the vaccines are safe. This has been found, over and over, not only from the trials, the clinical trials that were very extensive, where there was a lot of reviewing data and really observing each participant, each volunteer in the trial, and finally reviewing all the data, not only within the people doing the trials, but also the FDA and the ACEP and all the people involved before giving an authorization to be used. But now we have seen it when the vaccine has gone to millions and millions, and still we confirm that these vaccines are high. The safety index is very high. So we know that they are safe. And we know that they are safe for these groups because we had representation of most of it, but not the pregnant, but most of these other groups, we had them in the trials. And now we have been also using in pregnant women, there's trials going for that, and they are safe. And this is an interesting question when we talk about pregnancy, because the pregnant people are in high risk. They are very high risk to develop a severe COVID infection if they come into contact with that and they get infected. So that really, they are one of those examples where it's so clear that the risk is like way too much when you compare with the benefit. So the benefit is definitely gonna surpass the level of the risk. So, even if you're thinking, well, there is not enough data. Well, there's enough. There is a lot of data, but it's still you're not sure. Well, we do have enough data that tell us that they are in high risk. So it's better to have them vaccinated. That's one of those instances. Dr. Adamson.
I absolutely agree, and I do hear sometimes the concern that especially the Moderna and Pfizer vaccines are new and are a newer technology that hasn't been used in vaccines before. But in these trials, they did include many more people than are typically included in a vaccine trial, and we've had ongoing monitoring throughout that is much more intensive than any typical vaccine. So as was mentioned, there have been millions of people now who have received this vaccine. It's over 350 million people in the US have been vaccinated. And there is a reporting system that we're asking people to share any symptoms that have come up. And the adverse reactions from this vaccine have been very rare. So like a few out of every million vaccines are there like any significant reaction. And so yes, they're very safe. And like was mentioned, always with these things, we need to weigh the risks and the benefits. So for anyone, whether they're immune compromised because of a health condition or a medication or because of age or because of pregnancy, the risk of having COVID and ending up in the hospital or in the ICU is much higher than these very rare risks that have come from the COVID vaccine. I definitely get questions about the Johnson & Johnson vaccine for women because there were a few cases of a very rare type of blood clot. And again, that number of cases has been a handful out of over millions. And then while we don't do research studies specifically on pregnant women, this very close monitoring of the people that have received vaccines has absolutely included pregnant women. And we have not seen cases of lost pregnancies, like miscarriages as a result of the vaccine, or any complications with babies because of a mother receiving the vaccine during a pregnancy.
And one thing that you were asking also, Chris, about if this is the vaccine will affect the fertility. I think you asked something like that. It's a question that we hear often, and we don't have data that supports this belief or this assumption is not the case. So yeah, just to complete that question.
I have a question here from our participants for Dr. Urbina. And we do get this question a lot. So, people ask, if my child and I already had COVID, and we get that immunity, should we still get vaccinated? Can we talk about that a little bit?
Thank you, Angela, for that question. This is actually a very good question, and it's very timely because of the Delta variant. So I'll probably answer this in a two-part way. Early on, we thought that the immunity from the infection could last for a very long period of time. But as we've learned more about this virus, we think that actually the immunity wanes over a period of time, maybe 3 to 6 months, so that your protection from being ill actually starts to decrease because of the changes of the variant. So particularly with the Delta variant, people are getting reinfected. So we strongly encourage people, even though they've had the infection, that they should get vaccinated. It doesn't matter which vaccination that you choose. If you weren't vaccinated before, get a vaccine. And if the mRNA vaccines are 2 vaccines, and the Johnson & Johnson and Janssen vaccine is 1 vaccine. So the second part of this question is the whole discussion about a 3rd dose as well as booster shots. And as you see this on the national news, it's important to point out, again, we're learning about the evolving virus. Because of the Delta variant, we now know that the people that were early vaccinated, like you, Dr. Adamson, and me, will likely have to have a booster dose because the vaccine starts to wane after a period of time. And if the vaccine changes significantly enough, that we will have to have a booster dose. We also know that people who were immunized, particularly elderly or people with immunocompromised system, like they had cancer recently, or they were on a special drug that dampened their immune response, or they're on a high dose steroids, that those folks actually have to have a 3rd dose of the vaccine because it increases their level of protection by having that 3rd dose. So both of those, you're going to hear a lot more from your doctor. I'm sure Dr. Adamson is going to be talking about this in Clinica. We're going to be talking about it from Boulder County Public Health. So for those folks that were vaccinated a long time ago, we're going to be recommending a 3rd dose. For those folks who are immunocompromised, booster for those folks that need early vaccination, and then the booster, the 3rd dose for those folks that are immunocompromised. I hope that helps because the vaccine is only protective for a period of time. It doesn't, but it does protect you. We didn't talk about this, Dr. Elizabeth, but it does protect you from severe illness, hospitalizations, and death. Very important to say that going forward. Thank you for the question.
Thank you, Dr. Urbina. We actually have another question, and this is for the group. I'll open up for the group. Can my child get the COVID vaccine with other vaccines, like the HPV vaccine? I'll open it up to the group.
So, yes, that is a good question. And so people can receive the COVID vaccine along with other vaccines. So if your child is coming into clinic and for their well child check or whatever other reason, and they're due for other vaccines, they can get them all in the same day and just make that more convenient.
Does anyone else have anything to add? Go ahead, Dr. No, you're good. One of the other questions that we receive a lot is something that you touched on, Megan, was like, what are the risks, the real risks for youth who don't get vaccinated? And how do parents do that risk assessment? And what are some of the prevention strategies?
Yeah, so again, I mean, the risks are getting a COVID infection, and we just never, it's hard to tell who's going to get a mild infection that has barely any symptoms and who's going to get a more severe infection, even to the point of needing to be in the hospital or end up on a ventilator. And because of that, we want to protect everyone. And like we mentioned, even those who don't really have much of symptoms can pass it on to others. And the same is true. We don't want those severe reactions to happen in other family members or teachers or other people that we care about. So the vaccine is a very important part of providing that protection. especially against preventing those severe cases like hospital stays and the like. Wearing a mask absolutely will help as well. So wearing a mask, face covering helps to keep us from spreading those little droplets where the infection can pass from one person to another. Same thing with the physical distancing, which just keeps us from sharing our germs, making sure we wash our hands regularly, covering our coughs and sneezes. All of those things help. And one really dramatic thing that we noticed last year is that in addition to, wearing a mask and social distancing for COVID, all of those measures actually made us have almost no flu season. So we didn't see as many people coming in with flu and cold and all those things that typically happen in the fall and winter months. So all of those other measures, masking and social distancing and good hand washing, really do help prevent all sorts of respiratory viruses.
If I can add something, Angela, that's why, thank you, Dr. Adamson, the schools are going to be safer this year, because not only are we trying to vaccinate everyone that's vaccine eligible, including teachers and staff, but we've implemented an indoor mask rule in Boulder County so that everybody, whether or not they're vaccinated or unvaccinated, will have to wear a mask. That does add that extra layer of protection. And the good news is that our St. Vrain Valley School District, as well as Boulder Valley School District, have been very good partners in increasing their ventilation, recommending hand washing, respiratory etiquette, cohorting, keeping kids that are sick outside of school. Some of the schools are actually going to be testing, so that all of those layers that you talked about are all additive in protecting that the kids will be safer in school, I think, than last year. So I think that that's our priority in Boulder County. We want to see kids be healthy as well as go back to school and learn and have fun. And all those layers that you talked about are very important for school-age children.
Thank you. We do have another question, and I think a lot of people have been asking this question. So do we have a timeline yet for the vaccine for the age 11 and under?
I can take that one if you'd like, Dr. Elizabeth. We had hoped that it would be early before school started, but it turns out that the Advisory Committee on Immunization Practices, called ACIP, and the FDA had asked for more data. So it's likely to be probably late fall, early winter before we have those vaccine results studied. Because I think obviously any of the listeners, as well as us as parents, we want to make sure that our kids are safe with these vaccines and that they're highly effective. So they've asked for more data. So that for the kids, and they're doing those clinical trials right now, comparing kids who get the vaccine versus kids who don't get the vaccine, and making sure that it's both safe and effective for those populations. So it looks like it's going to be late fall, early winter. We will hopefully hear sooner that the mRNA vaccines, probably Pfizer first, will be fully approved probably in the next couple of weeks, so that those folks out there saying, well, I'm going to wait till it's fully approved, will have no longer an excuse not to get the vaccine. We think, all of us doctors here believe that the vaccines are safe and effective, shouldn't wait. But if those folks that are waiting, this will be another opportunity for them to get the vaccine.
Thank you. I have a question for Dr. Mendoza. We want to know, our parents want to know, what are some of the side effects that kids can expect when they are fully vaccinated, and how can parents monitor those side effects?
That's a very, very common question, a very relevant question too, right? So usually in kids, it's more like the pain in the arm. They complain more about that. Feeling not good, like malaise. Maybe they develop fever. Like just feeling bad in general. And this, this fever and this feeling bad, pain in the arm and all those things, usually those symptoms will go away within 24, 48 hours by themselves. But some, and for one thing, not all the kids will develop them. That's another thing to say. Not everybody's different. So not everybody's gonna develop the side effects, but those who develop them also may not have them as intense. Some may have it more intense. So if your kid is having like really, really intense and you're like, no, this, and you're right, this fever is not something that I can't wait for it to subside in 48 hours. The best is to contact your healthcare provider and just say, this, because of this fever, what should I do? And most probably they're gonna say something like, well, you can give your kid acetaminophen or ibuprofen or one of those things that they always give to your kid, as long as the kid is not allergic, obviously. So these are things that are controllable and that you have to keep an eye on them and just make sure that don't continue. I mean, the symptoms may show up, then kind of like reach a point where the max in a few hours, and then they start going down. If you observe that the symptoms are not going down, but the opposite, either they keep getting worse, the arm is getting worse, the kid is feeling even worse, the fevers are not going down, that adds up to respiratory symptoms, coughing, and all the other things, then that's when you have to contact your healthcare provider and say, this seems to be something out of the symptoms, the normal side effects that we were expecting from the vaccine, the regular thing. So, I mean, always you can consult with them, but know that not all the kids are going to present them, and each kid is different. So don't feel like because your neighbor's kid reacted very simply, nothing happened, your kid, oh my gosh, he's having a fever and all that, this is abnormal. Maybe that kid of your neighbor just doesn't react normally to the vaccines, too intense, but your kid does, and your kid is different, every kid is different. So any question that you may have beyond what we're saying, that this is normal, 24, 48 hours will go away, then you really want to contact your provider. Mm-hmm.
I wanted to ask Dr. Adamson this question as well. Is this similar to other vaccinations that you give into the clinic, like flu vaccines or the side effects that you see with COVID-19? Could you comment on that?
Yeah, so some of the side effects that we see from the COVID vaccine are very similar to the majority of other vaccines that we give. So that sore arm, sometimes some redness where on the arm where they got the injection, those can happen with many types of vaccines. With the COVID vaccine, especially after the second dose, some people have had slightly more symptoms, like fever, headaches, body aches, nausea. And all of those are within the spectrum of normal, but maybe a little bit more than parents might be used to with the other vaccines that they're typically getting for their kids. But as was mentioned, they're generally starting within 12 to 24 hours and are resolved within 24 to 48 hours. And kids kind of bounce back and do better, but it has been very variable. Some kiddos have almost nothing, and others are pretty uncomfortable for a few hours or a day, and then back to their usual.
Thank you. I have another question for you, Dr. Adamson. Do you have any tips for parents and their children on how to prepare for their COVID-19 vaccine appointment?
So in a lot of ways, this vaccine appointment should be very similar to any other vaccine appointment. Just know that you will be required to fill out a questionnaire that'll ask a little bit of medical history questions and if ever had any severe reaction to a medication or to a vaccine. So that's a little bit different, and that we typically don't have the one-page questionnaire with every single vaccine. We're also recommending that folks wait 15 to 30 minutes after getting the vaccine. So mainly making sure that you have plenty of time to hang out for that appointment and aren't trying to rush between one thing and another. But otherwise, the process of getting the vaccine is very similar.
Thank you.
And I think it's important to add that the kid needs to have your consent to get the vaccine. So be ready, to have that, be there, or at least depending on where you get your clinic, to receive a call to confirm that you're giving consent for your kid to receive the vaccine. I think that's one of the other important things to remember. It's just similar to the other vaccines, right? But it's still, some people are like, oh, there is a clinic right in the supermarket, just go get it, kid. But no, it's not like that. You actually have to give them your consent, and hopefully you can go with them. I mean, come on. When we were kids and we were gonna get our shots, it's like, I want to have mommy there. I don't want to send my mommy to the supermarket. So yeah.
And you can get your mommy's shot as well while you're there.
Exactly, everybody.
I have another question for the group. So how effective is the vaccine for youth? Is there a percentage that we can talk about, or any insight that you can give parents about the effectiveness of the COVID-19 vaccine?
I'd like to start on this one, Angela. Thank you. Early on, we knew that particularly the clinical trials and people we were studying, that the vaccine was 90 to 95% effective at preventing severe illness, hospitalizations, and death. And we also believed that the vaccine was highly effective in preventing infections, both asymptomatic and symptomatic. But if you remember, we were still recommending people wear masks at that time. As the virus has changed, we now are watching this very closely, that those originally who had been vaccinated, the effectiveness of the vaccine has started to wane. So right now we believe, and this is true of people that are now just becoming vaccinated, as well as people that were formerly vaccinated, that the vaccine is anywhere between 60 and 80% effective. And that's a broad range of effectiveness, because it depends on the population. If you're older, it's going to be less effective. If you have immunosuppression or a history of cancer or are on steroids, then it's going to be a little less effective. And that's true of all three vaccines. But that's still very good. It's still very good when you compare it to flu vaccines that can be anywhere between 30 and 70% effective. So it's still important that you get the vaccine. And because, as we talked about earlier, it does prevent severe illness, hospitalizations, and death, which is very important. We're starting to see some breakthrough infections in people, which means that they have been previously vaccinated or previously had the infection, are starting to get reinfected. That's what we call a breakthrough infection. But they're still rare, but that's why we're trying to get, because now the majority, if you remember the slides that we talked about earlier, the majority of the people that were hospitalized and died were unvaccinated. So that we know it does work. So it's important to still get the vaccine.
And I just want to make an emphasis on that of the vaccination, the complete vaccination, because sometimes it's like the parents ask about that. So what does that mean? When is my kid completely vaccinated? Like, because of that, the breakthroughs, people hear about those things. So completely vaccinated is really when you completed the 2 doses, and that at least 14 days or 15 days have passed since the second dose. But the essence here is you really need to get 2 doses, because kids receive the Pfizer, and that's a 2-dose vaccine. So it's not enough to having just 1 dose. Don't forget to get, your second dose within the time frame, as soon as possible, of course, within the time frame that is needed. I don't know, Dr. Urbina, do you have anything to add to that question?
Thank you, Lisbeth and Dr. Urbina. I have a question two questions actually for the panel. We'll start with the first one. Is the vaccine free for youth, and what information is asked of parents and children? What can they expect?
Yeah, I can take that. The vaccine is free. Free. Free and free of documentation as well, because some people get concerned about that. I don't wanna be showing my card or my where I live or my driver's license or I don't want to show any of that, or my passport, anything. It's free of documentation, is free of cost, and you can get it, and then you can get it in different places. But depending on where you go, is where you feel comfortable. Nowadays, there are so many places that if you feel like, I know that if I go that place because my friend went there and they asked my friend to show an ID and to show things, I don't want to go there. Then what do I do? And then, okay, wherever you feel comfortable. Nowadays, there's all these community clinics where you can go and they don't ask you anything. They can be in your barrio, wherever you live. They can be in the outside of the university, outside of the school. And they're not supposed to ask you anything. And even if they ask you to show anything, you can still say, I know I don't have my ID. I don't want to show it right now. But you do have to give your name, though, your name and date of birth, because you need to get a card. Otherwise, how do you demonstrate that you were vaccinated? So that's why they ask you these things, not because they are trying to get, sneaky, being sneaky and extract information from you for the government or anything like that. It's just so that you can have, that information for your card. And also to have an idea of how the vaccination efforts are going. That's why they may also ask you, well, where do you live? Or at least your zip code, and things of that nature. But yes, these vaccines are free.
Does anybody want to add anything to this response? So we're nearing the end of our town hall, and I wanted to open a question to the panelists. In your closing remarks, what do you think are the benefits of getting youth vaccinated and their parents as well? For your closing remarks, what can you tell parents and caregivers of the importance of getting vaccinated?
I guess I would just say that to me, the main benefits are, again, like keeping our families healthy, keeping our community healthy, and being able to get back to our usual level of activities, our school engagement, getting out and eating out, going to movies, all of those fun things that have been really challenging to do over the past year plus.
So yeah, I will add to that. Yeah, that's a benefit. Being able to go to school, being able to hang out with your friends, and having your kids hang out with their friends is very important for emotional development as well, for their emotional life, for their mental health, and for your mental health too, because you really want them to go to school, right? So you better get them vaccinated so they don't get anything. Because imagine if you were to get. And if they were to get sick, there we go again with all the quarantining and all those things and all those heavy things that we don't like. You already went through that. We should have learned the lesson at this point. So that's why now that we have a vaccine and we have the mask, we know they work. We saw it. I mean, we saw the effects of masking and social distancing. So we know these things work. And why don't we use them until we can get everybody vaccinated? Let's make a little bit more of an effort so that we can get closer soon, super soon, so that the point that we can really let go of all these measurements for good, because it's controlled. So by you getting vaccinated are helping the whole community to get to that point as soon as possible and avoid these heavy measurements that we don't like. So yeah, I think that's one of the big benefits.
I'd like to, in my closing mics, I really don't have a whole lot to add to Dr. Lisbeth and Dr. Adams's comments, except this. The Delta variant has changed the ballgame. It is more contagious. It is leading a significant spread among our communities, particularly among the unvaccinated. Now, more than ever, we need people to get vaccinated, because we not only protect, as both doctors have talked about, protect them from severe illness, hospitalization, and death. We protect our health systems from being overwhelmed. And finally, we can prevent all the mitigation strategies. Remember the locked doors, the closing of restaurants, all those things. We want to be as normal as we can by doing the right thing now to get the vaccine, and continuing to do all the mitigation strategies that Dr. Adamson said. we can go a long way to help our communities be safer and healthier. It's that straightforward. And I urge people to get information and stop spreading misinformation. We've tried to provide this community forum so that you can spread the correct information that's scientific. I'm a family doctor. Dr. Adams is a family doctor. Dr. Mendoza is a physician as well. We are health experts. We want to help you make the best decision for you, for your family and your community. So thank you all for coming.
Thank you. I want to thank the panelists today. I also want to thank the participants, and I want to remind our participants that we will have an all Spanish town hall for caregivers and parents next Wednesday, August 25th. So please join us and spread the word. And if you didn't get your question answered, please join us next time or send your question to healthinfo@bouldercounty.org. Thank you, everybody.